Clinical and laboratory steps in single complete denture. Treatment of the abused tissue by using tissue conditioners, occlusal adjustment, and by correcting the extension of the existing denture. And that sometimes need the patient not to wear the old denture for a few days. Surgical correction may be needed in according to the extension and severity of the condition. So the reduction of the enlarged tuberosities surgically to allow the lower RPD to be in occlusion and to orient properly in relation to the retromolar pad area and buccal shelf area. Splinting the remaining natural mandibular anterior teeth to provide a removable partial denture with positive occlusal support, rigidity and stability. This also minimizes the excessive stress on the anterior natural teeth, and by this way, this provides a posterior teeth to minimize occlusal pressure in the anterior maxilla. So, if needed, the surgical intervention is mandatory, like vestibuloplasty, excision of the flabby tissue. Then the occlusal plane adjustment should be done. So this should be done by simple controlled grinding to correct the minimal interferences. So there may be moderate to severe interferences which will indicate the crown construction with regard to all the principles of crown and bridge restorations. Next is your individual teeth modification. Sometimes small, one or two teeth or three teeth which is going to interfere the occlusion. So that time the sharp unwanted cusp should be reduced and that create a reduced cuspal inclination. So the heavily abraded teeth which will reduce the buccolingual width. So this is seen in some cases that due to the extension of the posterior teeth and anterior teeth are used in function that leads to this type of ablation. So the occlusal adjustment of the natural teeth is preferable to accomplished in the diagnosis step itself. But in certain cases, that may be done or further adjustment can be done at the try-in visit. Natural teeth adjustment must be as much as needed. Only take your time to decide the areas and the extent of the tooth needed to be removed. And this should be planned by using a cast and articulator. Even you can use the splint that can be constructed to guide the adjustment. So this problem may need orthodontic repositioning of the opposing teeth that indications and age with orthodontic considerations or by altering the clinical crowns of the teeth by means of selective grinding or with a restoration. Of course, the clinician may be forced to accept the good centric occlusion contact and premature contacts in the eccentric positions. So, the excessive premature contacts often cannot be eliminated. Therefore, proper occlusal relation considering some modifications. So these are certain works should be done before going for giving the normal dentures in the patient. Thank you.